Common situations that will require oxygen therapy will involve dogs that have become unconscious following smoke inhalation at a fire. Importantly, we need to think about the size and breeding of the dog. That will help us to determine risk later on, but also think about how many people we would need to actually physically rescue it from the fire compartment or the house. As soon as practicable, it's important to apply restraint in the form of a slip lead or an improvised lead. If the dog requires a two-person carry or the breed characteristics indicate, then it's important that we apply two leads early on. Remove the dog to a casualty treatment area. Ideally, this will be away from further stimulation, away from people and noise. And we're going to initially check the face and airway to determine whether we need to take any action to remove any constriction. And then commence oxygen therapy as soon as possible at 5 litres per minute. Move the animal to a sternal recumbency position and ensure that the airway is maintained. Good practice as soon as possible would be to fit a muzzle. That will be in preparation for it regaining consciousness. Now, the good thing about basket muzzles is that the animal will still be able to drink, still be able to pant and lose the heat that it may have built up, but it's not going to cause us any risk, and also the oxygen therapy mask will fit snugly over the top of the muzzle. It will also support that move, the transfer of that animal to definitive veterinary care. A conscious animal that's received smoke inhalation should still have oxygen therapy if safe to do so. And that's the important consideration, because if a dog is aggressive or anxious, then it's going to naturally be taking in more oxygen, and therefore to put it under more distress by applying the kit would be detrimental to its welfare. So think about this, your safety, make sure that you've got the sufficient restraint that you need in the form of a lead or two leads if the dog's size requires it. And as soon as possible, if you can, get a basket muzzle onto the animal, which will then negate the risks as you move forward. Cats can be a little bit more tricky in that they have a variety of weapons that they will use if they're anxious or scared. So the reason that we have a towel is so that you can wrap the cat, but it's really important that as soon as possible you find some safe place where you can contain it, possibly in a cage or a crate, where you can allow it to calm down and settle, and there's no chance of it escaping or hurting anybody in the process. If you're dealing with numerous animals, particularly lots of small animals like kittens or rabbits, guinea pigs, those kind of things, then the oxygen therapy masks probably aren't the most appropriate way of oxygen application. So what you might think about is finding some sort of cage, maybe their own, or maybe something that's provided, where you can then seal it and you can provide an oxygen enriched atmosphere through the use of the cylinder and tubing. It's important that you enrich the atmosphere before you put the animals into that cage or that containment facility by introducing oxygen at 15 litres a minute to start with, and then turning it down when the animals are being put in.